Good afternoon, guys. I have discussion B for you. We are discussing Scotland end of life bill uh, for terminally ill patients. So that is what B is. So let's jump in and do the presentation. Here we go. Medical professionals, particularly through the Royal College of Physicians and Surgeons of Glasgow, are urging lawmakers to provide greater clarity in the assisted dying bills currently under consideration in Westminster's and Holy Rod. Their concern stems from a survey of 635 members, which revealed a near even split in opinion. While some clinicians support the principle of assisted dying, many worry about how vague or incomplete legislation could translate into daily medical practice, leaving doctors exposed to ethical dilemmas. Legal risks and inconsistent standards of care. What greater clarity means in practice? Eligibility and definitions. Doctors want a sharp doctors want sharper definitions of what qualifies as terminal illness prognosis. It is non notoriously difficult to predict, and without clear thresholds, e.g., expected survival time, clinicians fear inconsistent applications. Similarly, capacity assessments must be standardized. To ensure patients fully understand their choices. Safeguards and oversight. Medical professionals emphasize the need for strong guardrails, mandatory second opinions, independent review panels, and rigorous documentation to prevent misuse or unintended expansion of the law's scope. Oversight bodies would need clear authority to monitor compliance, clinician roles, and conscience. Many doctors worry about being compelled to participate against their beliefs. They want explicit conscience protections, clear referral pathways for patients and guidance on how assisted dying intersects with professional codes of ethics. Process logistics. Practical questions loom. Practical questions loom large. How quickly should requests be processed? What training will clinicians need? How should assisted dying requests be integrated with palliative care assessments? Professional stress that patients must be offered and understand palliative alternatives before proceeding. Public and professional discourse. Medical leaders have already cautioned doctors about how they express personal views publicly. Clear boundaries are needed to prevent confusion between individual opinion and institutional positions, especially in such sensitive debate. Survey snapshot and broader contexts. Mixed professional sentiment. The survey showed 49% opposed or leaning opposed and 41% supportive or leaning supportive. This division highlights the importance of precise, workable rules to guide practice in a profession that is far from unanimous. Policy momentum and pushback. In other jurisdictions, assisted dying debates have often hinged on definitions and safeguards. Critics argue that vague bills risk being dangerously inadequate, while supportive point to growing public demand and legislative interests across Europe and beyond. Why this matters for implementation and equity. Consistency across settings. Without detailed criteria, rural and under resourced areas could see uneven application. Rising equity concerns. Patients in smaller hospitals might face different standards than those in major centers. Integration with palliative care. Mandating palliative consultations. Ensures patients are not rushed into assisted dying without exploring symptom management, hospice care, or psychosocial support. This integration can prevent premature decisions and strengthen informed consent, protecting clinician autonomy and patient trust. Explicit uh, conscience protections and referrals mechanisms safeguard doctors from moral distress while ensuring patients are not abandoned. Clear communication standards also help maintain trust in doctor patient relationship. Broader implication. The call for clarity reflects a deeper tension. Assisted dying legislation sits at the intersection of law, ethics, and medicine. For policymakers, vague language may seem politically expedient, but for clinicians, ambiguity, the Glasgow College's intervention underscores that assisted dying is to be legalized. It must be accompanied by robust, detailed frameworks that protect both patients and professionals while ensuring equitable access and consistent practice across the UK. Would you like me to map this debate against international examples such as Canada, Netherlands, or New Zealand, where assisted dying laws have already been implemented, so we can see how clarity or lack thereof shapes outcomes? All right, guys, that's B for you. I'll be back on with C in a bit. For now, Gator Wellness, take care, folks.